Let's put the patient, not the bureaucrats, at the center of the system.
The GOP health care plan passed today in the House by the slimmest of margins without the support of a single Democrat. The two sides sharply divided over what the GOP plan means for the country.
Supporters say that if it becomes law, it would make insurance more accessible and affordable for all. But critics say millions of Americans would lose health care or be priced out of it. We sent our Kayla Mamalak to get some answers. She's in the newsroom with some of them. Kayla.
Yeah, good evening. 2017 to 2013. That is the breakdown of the House's vote to repeal and replace Obamacare. The vote taking place this afternoon. And while Republicans are treating this like a major victory, the Trump administration is still facing a big fight to squeeze it through the Senate. A victory lap for President Trump and House Republicans. A second attempt at passing the American Health Care Act has officially been approved by the House of Representatives, making this Trump's biggest legislative victory so far.
We have an amazing group of people standing behind me. They worked so hard and they worked so long. And what I said, let's do this. Let's go out, just short little shots for each one of us, and let's say how good this plan is.
If it passes the Senate, the bill will repeal major parts of Obamacare and replace it with a Republican health care plan. The bill would allow states to charge people with pre-existing conditions higher rates and would no longer require insurers to cover 10 essential health benefits, such as prescription drugs and maternity.
If you only provide maternity care as part of a health care package that women get, then only women are sharing the cost of that burden.
The American Cancer Society is one of many groups speaking out against the bill.
The House Care bill would throw 24 million people out to the curb and deny them health insurance, on top of driving up the cost for those with pre-existing health conditions.
Political analyst Steve Adubato says getting a bill passed in both houses is different than getting it passed in one. He says there's going to need to be some serious changes to the American Health Care Act before it ever passes through the Senate, primarily to Medicaid.
The fact is, there are more moderate Republicans in the Senate who are more willing to push back on this legislation and basically align themselves with Democrats. And that's why the two houses are not the same, even though they're controlled by the Republican Party.
Now, Congressman Dan Donovan from Staten Island is one of the 20 Republicans to vote no on this bill. He released a statement which reads in part, quote, "The relief needed for local families is not in this bill. The plan would cost seniors more for health care at a time in their lives when incomes are limited and they need health care the most." Derry?
Kayla, thank you.